Around the World with MS World. I'm Dr. Daniel Kantor, and I'm so happy to be joined here by Wendy from MS World and also by Kathleen Costello, who is the Associate Vice President for Healthcare Access at the National MS Society. I want to thank you so much for joining us. You chaired a lecture series that has to do with complex symptoms. Can you tell people back home, what do we mean by complex symptoms?
Yeah, so actually in MS, I would say that almost all symptoms can be complex because they're so interrelated and one kind of causes another to be worse. So I think when we talk about symptoms, we need to look at the entire person. We need to know all of the symptoms that someone's experiencing and how they're interrelated and how one might be worsening another. So all symptoms can be complex, but certainly symptoms of mobility, which can be caused by a variety of different sources within the central nervous system. Symptoms of mood, which almost everyone with MS may experience at one time or another. And mood can be manifest in many other symptoms that are also associated with MS, such as fatigue, such as cognitive dysfunction. So the complexity is not just the symptom, but it's sorting out what's the source of the problem and how do we best address it in terms of our management strategies.
Wendy, as a person with MS, when you hear about complex symptoms, what does it make you think about? What kind of questions does it raise for you?
Oh, that's hard. I was listening to you, thinking a million of them while you were speaking. How do you discern a symptom first, and when does it become complex? And because of the interrelation, when would you actually go to the neurologist and say it has now grown from numbness and tingling to mobility troubles or things like that? When does that patient make that leap, or is it up to the healthcare provider?
Well, actually, no. And this is really an excellent point. I think when someone is experiencing any symptom at any level, not trying to discriminate whether it's complex or non-complex, but when things are interfering with what you want to do, you really need to bring that up. Because the earlier that we can assess and the earlier that an intervention plan can be designed, the better off someone's going to be. And it's so much more likely that we're going to be able to provide something that's really going to help and return someone to the activities that they really want to participate in.
And I'm assuming, like MS, it must be different in every single patient.
Absolutely. All symptoms of MS become heterogeneous. Even if 10 people all have fatigue, all 10 are going to have a little different manifestation of fatigue, or whether it be mood or mobility. There's similarities that allow us to know that it's related, but each person is going to be affected differently. So each treatment plan is designed between that provider and that individual to really best get at what that issue happens to be and help to return someone to what they want.
And are you able to give me examples of what a treatment plan might look like?
So if it's a mobility issue, so say someone has a stiffness or a weakness, that would be a referral to physical therapy, where the physical therapist would assess the problem and assess it by watching someone walk, by testing muscle strength, by testing to see how much stiffness is present. And then once identifying what the issue might be, maybe it's balance or stiffness or weakness. Now you've identified and zeroed in on the problem, you can design a plan that zeroes in on that. So maybe it's working on core strength to work on balance. Maybe it's working on eye movements that affect balance. Perhaps it's just stretching to work on spasticity that's interfering with someone's gait. So a lot of it is identifying, really zeroing in on the cause of the symptom and then designing that appropriate treatment plan.
Now, having been in physical therapy myself, sometimes just for things I've done accident-wise, is there a finality? Is there a beginning, a middle, and an end to it? Or is this something that a patient would have to do forever?
So I think it's something that someone has to participate in. It's great while someone's in therapy because you have your own personal coach, right? So someone's now helping you. They're helping you figure out how to do a certain type of exercise. They're coaching you through it. They're cheerleading you through it. But the problem is when physical therapy is over, now it's up to the person to carry forward. And that's hard. That's hard. And I've met some physical therapists who bring people back periodically just to kind of check in, just to see, hey, how's that going? Is that still working for you? And it's always reassessing and making sure that that initial treatment plan is really the one that's still working for you. And are you able to do it? Are you able to stay motivated? Because that's hard. That's hard whether you have MS or not, right?
Yeah.
It sounds like the term complex symptom is just a fancy way of saying that the symptom is caused potentially by more than one problem. So for example, mobility. So walking can be caused by weakness, it can be caused by tightness, so muscles spasticity and tightness. It can be caused by sensory problems. It can be caused by vision. It can be caused by all of those things, or by a few of them. And that's what makes it complex, is that you have to tease out the different aspects in order to give the best therapeutic plan that can be the most individualized for each person with multiple sclerosis. I want to thank you so much for joining us.
pleasure.
And I want to thank you for joining us, and thank you everyone back home.
Thank you.
Yeah.